Imagine someone with runny nose walks into the room and the next day you already have sore throat. Most likely it is common cold, because common cold has very short incubation period. It means that in a couple of days you already can have symptoms after contact the infected person. While Kraken or Omicron COVID-19 variant needs around 3 to 5 days. Usually it's 5 days. So if you have symptoms already next day, it's with high probability common cold. Let's discuss another example. For example, you have runny nose, sore throat, mild fever, fatigue, weakness. Most likely it is also common cold. Why? Because probability of common cold is very high. If you have no other information, most likely it's also common cold. Because in adults, common colds occur 3 to 3 times per year. It means very common, more than 100% probability per year. It's very common infection. So common cold has higher probability than any other infections like influenza, like Kraken, Omicron. But even Kraken has higher contagious. It's 60% in case of Kraken, which is a variant of Omicron. Still, common cold is more common because common cold, of course, common cold has 50% contagious. It's lower than Kraken, but common cold already have lots of people. So lots of people already spreading common cold. That's why probability of common cold is still high. Now let's deep dive and compare Kraken, common cold and influenza. Sore throat. Sore throat is very common symptom of Omicron and Kraken. Also very common symptom of common cold and less likely for influenza. It can happen, but still less likely compared to common cold and Omicron. Runny nose is very likely in case of Omicron and Kraken, very likely also in common cold. So if you notice, common cold and Omicron look like each other. Fever, very likely also in case of Omicron and less likely in case of common cold. That's the important difference. For example, you can still have fever in case of common cold, but it will be very mild. In case of Omicron, it can be higher, and chills also common. Chills is not common in case of common cold. Chills is more common in case of Omicron. Fever is very common in case of influenza, and in many cases influenza starts with fever. So it's very important symptom of influenza virus. Persistent cough is common for Kraken, less common for common cold. Also common for influenza. Fatigue, very common for Kraken. Sometimes it's still common, but less common compared to Kraken in case of common cold, and very common in case of influenza. Body aches, also common for Kraken, less common for influenza, common cold, and very common for influenza. Nausea, vomiting almost never happens in case of common cold. Sometimes it still happens in case of Kraken, same in influenza virus. And loss of smell. Loss of smell is specific for COVID-19, so it can happen and it can be specific symptom. If you lost smell, high probability high probability it's Omicron and Kraken. Almost never in case of common cold, and very few cases in case of influenza. And incubation periods, usually 5 days in case of Kraken, 2 or 3 days, but it can be 1 day in case of common cold and 1 to 4 days in case of influenza. But very important and specific difference. Common cold starts with sore throat and then runny nose, and influenza starts with fever usually. That's the difference. So you can differentiate them. If it starts with fever and suddenly fever, it's influenza. If it starts with sore throat, you wake up and your throat is not good, and then second day or third day you have already runny nose, you sneezing, that's common cold. But if it starts with fever and severe sore throat, it can be influenza. And body ache also very characteristic for influenza. That's the difference. I hope you understand the difference between them. And also I will add about complications. Complications very unlike in case of common cold. In case of Krakens, we can have some complications, especially in immunocompromised patients, such as, for example, aged people. We can have some complications and some death also because of Omicron. Same to influenza. We have complications. Almost never serious complications in case of common cold. Of course, if person's general condition and general health is very poor, of course complications can also occur in common cold, but rare. In case of Kraken, it's still common, especially in aged people. So third question, if vaccination protects us from Omicron, vaccination does not work well in case of Omicron and especially Kraken. And Kraken is dominant variant of Omicron right now in the world. Thank you very much. If you like my videos, please thumbs up. If you like my channel, please subscribe. Thank you very much. Bye for now.